What role does patient satisfaction play in expanding your client base?
It is true that if your patients like you and they're getting better, that is the key to a successful business, right? You're a service provider. You don't have a product. Your product is the service you're providing. If you do a good job providing that service, that's how you're going to build your business. Our field is tricky because even you can sometimes maybe not be doing a great job with the service you provide, but be a nice person, and it still can be good for your business just because you're a nice person. But the reality is that because mental health issues are so prevalent in our society, if you're treating 40 patients and you're doing a great job with them, again, 1 out of 3 adults, 1 out of 4 kids could use mental health services. So they're going to let their peer, one of their friends, colleagues is going to say, oh, I'm really depressed. Hey, you should go see so-and-so. They've really helped me. That's just going to be a natural growth pattern if you provide a good service. Other ways to make sure, and I think this is a problem in our field, that we don't do enough check-ins on how our patients are doing and how the sessions are going. And I think this is something else that I think we're evolving to do better. But because there was this kind of secrecy or what goes on behind the closed door in the therapist's office that was in this field for so many years, it's taken us longer to be really checking in on how our patients are doing. And so that's why I've always been a big fan of outcomes measures, and we built it into Ripsy to be non-burdensome and easy. But you've got to really, I think, even do more than a verbal check-in and really have patients write down both how they're doing with the reason they came into therapy at first, and then also being direct in asking how am I doing as a provider? How are you satisfied with your treatment? What can I do better? You can always do things better. And clinics and practices need to be a little bit more fine-tuned to be getting that regular feedback from their patients. Again, in general, your patients build a relationship with you, and if you're a kind person, they may not want to say, hey, I'm just as depressed or I'm worse, even though I've been coming to see you for 7 months. And so just because they kind of show up and smile and participate, they might not be getting better, and they might be embarrassed about bringing up that they're not feeling better. And so we as providers have to do a better job of making sure that that's happening.
Well said. Well said.